Good morning, everybody. Thank you for joining me for another video. I hope you are all doing very well. Today's video is going to be a health video again, two of the many of the ailments that I'm struggling with. And it's going to be Barlow Syndrome and Ménière syndrome. Barlow Syndrome is also known as mitral valve prolapse or click murmur syndrome. So how does the heart work? The mitral valve is one of 4 valves in the heart that keep blood flowing in the right direction. Each valve has flaps, leaflets, that open and close once during each heartbeat. If a valve doesn't open or close properly, blood flow through the heart to the body can be reduced. A mitral valve prolapse, one or both of the mitral valve leaflets have extra tissue or stretch more than usual. The leaflets can bulge backward, prolapse, like a parachute into the left upper heart chamber, the left atrium, each time the heart contracts to pump blood. The bulging may keep the valve from closing tightly. If blood leaks backward through the valve, the condition is called mitral valve regurgitation. It can develop at any age, run in families, be linked to other conditions such as infection and connective tissue disease. I'm trying to read without my glasses here because the reflection of a ring light is terrible if you read with glasses. And I'm almost at the stage where this is not going to be possible. Symptoms of Barlow syndrome may include the following: an irregular heartbeat, arrhythmia, palpitations, shortness of breath, dizziness or lightheadedness, and fatigue, of which I actually have all of them. Then I have my this is the first time that I went to see a heart specialist. This was on the 7th of November 1997. Oh, that's many years ago. Goodness gracious me. Okay. This was the cardiologist's report. I was 32 years old at the time. Oh my goodness. So, 32 years. Thank you for referring this lady for an evaluation of her cardiac murmur and chronic fatigue. For my record, she has experienced intermittent episodes of extreme tiredness accompanied by myalgia, night sweats, and enlarged cervical glands. These glands here in my throat were very big, swollen, and tender. In addition, she complained of an intolerance to ethanol, which makes her feel extremely nauseous, and she vomits at times as well. Although I have no details on hand, I gather that you and Dr. Venter have investigated this problem and concluded that her symptoms and signs are due to a recurrent viral infection. As a result, her effort tolerance has deteriorated at times, and inquiry revealed that she occasionally develops atypical chest pains and infrequent palpitations, which are usually rapid, regular, and sometimes wake her at night. I didn't realize actually that I suffered from exactly the same symptoms more than 20 years ago, 25 years ago. In addition, she feels anxious and often develops paresthesia affecting her extremities, which probably suggests that she panics during these events. I still panic during these events. Seems like nothing has changed in my life. Finally, I gather that she often feels lightheaded on exertion and recently fainted several hours following an injection warranting admission to the polyclinic casualty department, where she was probably treated conservatively assuming that her syncopal attack was due to a vasovagal event. On further systemic interrogation, she complained of polyuria, polydipsia, and occasionally perspires at night. In the past, she has required a tonsillectomy as a child, excision of a bony growth on her left foot, and excision of benign breast masses on the left side between 1985 and 1994. I've got no idea what this has to do with a heart problem. Inquiry into her family history revealed that several members have hypocholesterolemia, including herself. Her maternal grandfather, who also had hypertension, died after sustaining a heart attack in his 60s, and one of her maternal uncles required coronary bypass surgery. As you probably know, she is a qualified music teacher, a non-smoker, and seldom takes alcohol. Furthermore, she enjoys jogging and exercise on a regular basis. On examination, I discovered this attractive young lady. Don't know why he had to use those adjectives in there. Um, to have a slender build with longish extremities and hyperextensible joints. However, there were no abnormal general signs, evidence of hyperlipidemia or thyroid disease. Her blood pressure was 140/90, and pulses were regular throughout the observed period. Her cardiac apex felt dynamic and no parasternal lifts or thrills were palpable. On auscultation, her heart sounds were relatively loud. A systolic click was widely heard. A grade 1 to 2/6 Leachy's systolic murmur, which was maximally heard over her apex, radiated towards the axilla, and a grade 2/6 coarse systolic murmur, which was heard at her left sternal border, radiated towards the pulmonary area, but not diastolic murmurs or other added sounds were audible. Her chest was clear, and the rest of the examination was non-contributory. An electrocardiogram showed her to be in sinus rhythm with a normal PR interval, and her QRS axis was 50% plus. Though the tracing revealed a slight intraventricular conduction delay with LV dominance, it could pass for normal. Also did not read that up. A chest X-ray showed her to have a normal cardiothoracic ratio, and there was no evidence of chamber enlargement. Her great vessels and lung fields seemed normal. It occurred to me that this lady may be autonomically unstable, such as one finds in patients who have diabetes or a Barlow syndrome. An echocardiogram, which confirmed my impression, showed her to have a significantly billowing mitral valve, and mild eccentric mitral regurgitation was recorded on Doppler. Her left atrium and right heart chamber dimensions are normal, and the ascending aorta is slightly ectatic, such as one finds in Marfan syndrome. Although one cannot refute the possibility that this lady's episodes of tiredness were due to a recurrent viral problem, the above-mentioned findings suggest that she may have Barlow syndrome. Consequently, assuming that she is autonomically unstable, I decided to prescribe a small dose of that was a beta blocker, and an anxiolytic agent was added to her script. Under the circumstances, I advised her to limit her ethanol intake, avoid caffeine-containing products, and request an antibiotic prior to dental extractions or surgical procedures in future. Naturally, I would appreciate it if you would send me copies of the blood results to avoid me repeating these tests. Further investigations, including an effort test and Holter recording, will depend on her response to this treatment, which I plan to re-evaluate in approximately 3 months' time. And then he was furious with me when I went back in 3 months' time, and I did not, on 6th of February 1998, and I did not uh, went and filled the prescription that he gave me, because I used to use beta blockers for performance anxiety. And I knew that it made me very lethargic, very energyless, and it gave me some bad headaches. I could not see myself function like that, to feel like that every day. And he was furious with me, and he refused to do the other tests with me unless I actually um, went and took the medication that he prescribed. And I laugh about it, but it's not funny. That was on the 6th of February 1998, he says. Um, Assuming that this lady has Barlow Syndrome, I was concerned and disappointed to establish that she has only taken propranolol on a PRN basis and sometimes uses 100 milligrams Inderal as a stat dose to improve her performance. As a result, she has continued to experience atypical chest pains, occasional palpitations, dizzy spells, and feels energetic at times. In addition, she often feels nauseous and has difficulty sleeping at night. On examination today, she looked relatively well, and there were no abnormal general signs. Her blood pressure, which was 150/80 in the prone position, decreased to 130/90 on standing, and she was bradycardic with regular pulses, having taken a large dose of propranolol. Her cardiac auscultatory features were similar to previous observations. Chest was clear, and there were no signs of cardiac failure. Considering his symptoms and the above-mentioned findings, I came to the conclusion that this lady is autonomically unstable, such as one finds in patients who have Barlow syndrome, and consequently I urged to try taking propranolol, a PER blocker, or Inderal 20 milligrams. I would not take Inderal because I knew exactly what Inderal does. I've been using Inderal by that time for almost 10 years, 12 years for performance anxiety. And I did not want to feel like that every day. So he was cross with me, and what do they say? Kudos to him. As before, I advised her to limit her ethanol intake and avoid caffeine-containing products. Finally, provided she can tolerate this treatment and her symptoms settle, I plan to review her cardiac status in approximately 2 months' time. This caused such a rupture between me and this cardiologist that I did not see him again. And he was the cardiologist on duty that Easter weekend when I had my heart attack. The first time I saw him after what was it, 6th of February 1998. And he was also the one that stented me, this cardiologist. Small world. And then we ran into problems again because he refused to believe that the clopidogrel was giving me hallucinations. And then he's retired now. And then I didn't see him again after that. I went to another cardiologist, which stuffed my stomach and my intestinal linings up because of ridiculous expectations for somebody who has familial high cholesterol and who had a brilliant cholesterol count for that condition of 2.4 and he insisted he wanted 1.7. Crazy. After I told him explicitly, don't mess with my regime because I am hypersensitive to medications. You're going to throw my immune system out, which is exactly what happened. Exactly. A year later, November, was the end of November a year ago. I had a terrible year of having almost done nothing in and around my house and still struggling to get some of my motivation and energy levels back so that I can be the person that I was before this whole thing happened this year. I'm just having some black tea, bush tea, honey flavored bush tea. Okay, that is the Barlow Syndrome. And now I'm just quickly going to do Ménière syndrome. Meniere's disease. It is a disorder of the inner ear that can lead to dizzy spells, vertigo, and hearing loss. In most cases, Meniere's disease affects only one ear. It can occur at any age. Mine was my mid-30s. My eldest sister was now, a few months ago, in her early 60s this year. And my mother was in her late 40s. But it usually starts between young and middle-age adulthood. It's considered a chronic condition. Symptoms is recurring episodes of vertigo. You have a spinning sensation that starts and stops spontaneously. Episodes of vertigo occur without warning, usually lasts 20 minutes to several hours, sometimes several days, and severe vertigo can cause nausea. The problem with this is that it gives you, me in any case, very much the same sensations and symptoms that I had with my heart attack. I had no pain. Being seconds away from dying of a heart attack and having a sort of a build up to it for 6 weeks while still trying to go for a run every day, I had not a single sign of pain, nothing whatsoever. Not in my chest, not down my arm. I didn't have a pressing feeling of something that's sitting here on my chest. I didn't have that at all either. It was dizziness, nauseousness, fainting, everything which can be coupled to Meniere's disease, which makes it very difficult to distinguish. I often go to ER thinking that I'm having a heart attack and then I'm actually having a bad vertigo spell. Very embarrassing. It can cause hearing loss. Meniere's disease may come and go, particularly early on. Eventually, most people will have some permanent hearing loss. Um, it blocks the esophageal tubes, and then you get that hollowness, almost what you get if you fly. Ringing in the ear, that is known as tinnitus. Tinnitus is the perception of a ringing, buzzing, roaring, whistling, or hissing sound in your ear. Feeling a fullness in the ear, that I get very often, especially when I take medication, which my system doesn't want, then I get that fullness in the ear, and I'm forever here in the ear. People with Meniere's disease often feel pressure in an affected ear, oral fullness. If I get sick and it's going to be a bad stomach bout of gastric enteritis or flu or whatever, it immediately goes into my ears. When I cannot tolerate a specific medication, if I have allergic reactions to it, it immediately affects my ears. Irina had a bout now a few months ago. She was also teaching at school. She was making herself a cup of tea and she started to scream for help. She said she thought that she was dying because that's what it feels like, especially if you don't know what to expect and it's your first attack that comes along. Mine happened many, many years ago in 2000, before 2000, 1990, 1998, 1999, round about there. And I was I was a freelance teacher, traveling teacher, and I was teaching flute at Alexandra High School. And because I wasn't a permanent teacher, I didn't have a permanent classroom. And my classroom was then in the hall underneath the stage. So I had to go down 2 flights of stairs and then I was underneath the stage. And I can remember I had this boy with me and I was starting to not feel too good. I was first accompanying him on the piano. Then I had to do some solo teaching and I was standing next to him. The stand was quite high up because we were standing. And I said to him, I'm not feeling too well. I can't stand anymore. I'm going to have to sit if you don't mind. So we went, put the stand down, and I was sitting on the piano chair, and he was sitting in a chair and teaching for a bit like this. And I said to him, you know what? This is now going to sound ridiculous, but I can't sit on this chair anymore. I'm going to have to sit on the floor. There was a carpet in. And in the end, I said to him, you know what, I can't sit anymore. I'm going to have to lie down. But I thought that it was my blood sugar. I said to him, why don't you quickly go to the tuck shop? I gave him some money and just buy me some donuts and some chocolates, please. And while he was away, I thought I was dying. I had to crawl on my hands and my knees and my stomach up those 2 flights of stairs. And as I reached the top, I just started to shout for help. The music secretary, the music department at that school has got their own secretary, and her office was in the back of the hall. And I just shouted and screamed, and she came to help me, took her to the office. I lied there with my legs up in the air, and she started to feed me sugar water, which was getting, every glass was thicker and thicker. And then they said, just see if you can come up now. And I couldn't. So after about 2 hours of trying to get me up into a sitting position, they then decided they will take me to the doctor. And some of the people were kind enough to bring my car home because I couldn't drive. And my mom wasn't speaking to me. My mom and dad wasn't speaking to me at that point in time. I must have done something wrong again. So I was getting the passive aggressive silent punishment treatment. So I couldn't phone them, although they were just up the road, basically. And I had to be wheeled into the doctor's consulting rooms. I couldn't walk. And then they brought me home, and then I had to struggle for it was about 5 days at home, all by myself, because my parents weren't talking to me and didn't see me at this point in time. I can't remember what I must have done wrong. And for not being able to, but I didn't have all the animals then. I had some dogs and some cats. I just couldn't help myself because you can't get up. You like drunk, drunk, drunk. And that's why I don't drink any alcohol, because I drink tablets if I feel, I know the symptoms now, so I can drink a tablet to prevent it. And so why would I drink alcohol that's going to immediately affect the balance in my middle ear and cause me to feel sick? So that's one of the big reasons also that I don't drink alcohol. And I actually got still a few things to say on the Ménière syndrome matter, but if I'm not going to end off the video now, my phone is going to cut off. So I'm going to say thank you for watching. At least you know where 2 of my problems are coming from, which I can then refer to in videos in future, and you will know what it's all about. Thank you for being here. Thank you for making it this far. Thank you for staying to make it this far. And you must keep well and look after yourselves. And I hope I see you in the next video. Goodbye.